Hello and welcome. I'm your host, Mary Kate Eaton, Executive Director for Education Programs and Chief of Staff for the Community Partnerships Division at Providence. As a reminder, the information provided during this event is for informational purposes only. If you have any medical questions, please reach out to your primary care or health professional. Today, we'll talk about the University of Providence's Health Justice Certificate Program. The study of health justice introduces students to the concepts that build and surround medical legal partnerships. In this program, coursework includes discussion of legal remedies for social determinants of health and other health inequities and health disparities by improving cross-discipline communication, identification of policy change to improve population health, and serve the poor and vulnerable in order to achieve social justice. So joining me during this live event are Zaidas Rivera, who serves as Immigration Clinic Director for Gonzaga University School of Law and an advisory board member with the Health Justice Program, and Tracys Rooks, adjunct faculty within the MHA program and program coordinator for the Health Justice Certificate at Providence. So, Tracys and Zaidas, can you tell a little bit about how this program was developed and how it fits into the healthcare space?
Absolutely. Thanks so much for having us, Mary Kate. So I became interested in medical legal partnerships back in 2014 when I was a compliance officer for a critical access hospital, and I wanted to get more legal remedies available for our rural patients. And when I came over to Providence and started teaching for the MHA program, we very quickly started developing this health justice certificate because it was such a relevant topic and so much in need of these services. And part of that was bringing on amazing advisory board members like Zaidas, who have the real world experience to bring that to our students.
Absolutely. And this program has been really great. And I learned about the medical legal partnership when I was working in New York previously. And it was just such an interesting concept to provide holistic services to a patient client and who's dealing with not only medical issues, but of course, somehow there's always other issues that they're dealing with. So I think this health certificate is a great way for individuals to learn more about those issues and challenges that a lot of our community members face when they're patients and or clients as well.
Thank you both. So Zaidas, tell us more about your background and how you got involved with the Health Justice Advisory Board.
Sure. And again, thank you, Mary Kate, for the invitation to be here today. It's a pleasure to be here. And yeah, so I am an immigration practitioner. I've been practicing immigration law for almost 9 years, primarily here in the state of Washington, but I also spent 2 years in New York and New Jersey. And I've mostly done family-based immigration and deportation defense. And so I was very excited when Professor Rooks reached out to me about the program and the health justice certificate and potentially serving as a advisory board member through my experience with immigration. I was very excited, and I said, yes, I'm happy to be part of it. And just like I mentioned, learning about the program has been really great because I think it's another way for our community to get additional services. And so I am an immigrant myself, and I, have a lived experience of what immigrants face and also the barriers they face in the health justice system or the health services. And so it's really great for me to be involved and provide my legal expertise as an immigration practitioner, but also bring in kind of that cultural competency of being an immigrant myself and working with our immigrant community.
Thanks so much, Zaidas. So Tracys, kind of another perspective, as someone who works for Providence on the legal side, how have you seen this field grow?
Yes, medical legal partnership has expanded across the country. It started on the eastern side of the country and has moved westward as some of our healthcare trends tend to do, but there are hundreds of medical legal partnerships all over the country. But even with that growth, unfortunately, that hasn't kept up with the exponential need with our patients. So that's part of why we developed this program, is to bring the awareness to students, our healthcare leaders, leaders in the legal field, and bring that awareness so that we can begin to close that gap between the services that are currently available and meeting the needs of our patient clients, like Zaida talked about.
Thanks, Tracy. So, Zaida, you mentioned your background as an immigration attorney. You've seen firsthand the struggles that immigrants can face in regards to legal representation. Can you explain how the medical legal partnership would benefit this population?
Absolutely. So the way that I see and what I've learned about the medical legal partnership is that it's another resource for our immigrant community to obtain information, and maybe not legal representation, but at least get an intake, figure out what their situation is and what potential avenues they have. And immigration system is very complicated. They say it's second most complicated to the tax code, just because there's so many different statutes, policies, case law that we have to look into. And, every case is different and every person's situation is different. Their outcomes might be different. And so I think the medical legal partnership is a great opportunity for individuals who have some sort of immigration issue to be able to address that while being a patient, and getting the assistance they need for their medical conditions, but maybe they also have other issues. And typically, as we know, people in poverty and people, a lot of times we find that people who have immigration issues also have other issues, right? Because someone who doesn't have immigration status then might lose their job, therefore they might lose their housing. They might not have food. And so there's just an array of issues that come along with immigration status. And so the medical legal partnership, I think, really helps to address their concern about their immigration status, and seeing what the attorneys through the program can do to help them assess any eligibility they might have for immigration status, refer them to organizations that might be able to provide assistance, and also help them navigate through the health system in terms of what benefits they would be eligible for example, as an undocumented person who is seeking medical assistance, but they don't have any insurance, right, and are eligible for public benefits because of their immigration status. So I really think that the medical legal partnership is a great avenue for individuals to get access to legal resources, which I think is such a huge issue, especially like Professor Rooks was saying, individuals in rural areas that are farther away from the cities, farther away from the firms and the big organizations that are available to help people. And so if there can be some sort of way that they can get that service through the medical legal partnership and refer them, or do either a phone consultation or virtual, that is now definitely very doable. It would be really great for them to be able to discuss their immigration issues and see if there's any relief for them available.
Thank you, Zaida. Sorry.
No problem.
So next up, the next question is for both of you. So obviously, COVID-19 has been a huge part of our daily lives over the past couple of years. And I'm wondering, where does health justice fit into the pandemic, and why is it important?
Sure. So I'll go first on that one. What we've seen throughout COVID-19 is really highlighting the gaps that were there within the legal system and within the healthcare system, and the people who fall through those gaps. So what we've done with the health justice certificate is we've tried to develop a program that not only highlights those gaps, but focuses on how can we find solutions? How can we close those gaps? Are there some grassroots legislative initiatives that we could initiate? For example, the Medical Legal Partnership at Seattle Children's, they were noticing that infant mortality was very often tied to sleep disorders. But in the state of Washington, sleep studies for children under a year old were not covered by Medicaid. And it was a big population within the Medicaid population that was experiencing these, unfortunately, infant deaths. So Seattle Children's worked to get sleep studies covered under Medicaid for children in Washington state under 12 months of age. So those are the kind of things that we see it as a gap, and we want to work with different partners and the legal system, the legislative branch, or like Zaidas talking about, actually in the courtroom for immigration court, to find a solution and to work for those better health outcomes. So speaking very broadly, that's kind of how health justice has been in the news, really. It's been a really relevant topic throughout the pandemic. So we know where the gaps are. Now we want to focus through this program on closing those gaps, finding solutions at either a community level, a state level, or even a federal level. Students can choose to scale their project, their portfolio project across the program, however big or small they want, identify the partners that they want to work with, and really map out a plan for how they're going to achieve that improved patient outcome. So yeah, Zaida?
Yeah, absolutely. I think that in terms of my work in the immigration context and how COVID has affected individuals, I think, as we can talk about a little bit more later, there's definitely sometimes with undocumented community, there's fear, right, of accessing hospitals and going to the doctor, and more so because there's distrust in the systems, right, in the government systems, and sometimes people will equate the hospitals as government, right? And so they might be afraid because they might think, oh, are they going to report me to immigration officials? And so people are afraid to go seek help. And especially in the COVID context, people might be afraid to go get tested, right? Or go get vaccinated because they might think it might affect their status, or they might get into trouble somehow. And I think that there's a lot of education that needs to be done around that, informing people that no, the hospital is not necessarily, part of ICE or like the government, and they're not going to report you. And so I think that's where the Health Justice Project certificate, comes into play, where there's a lot of education about the intersectionality between the healthcare system and immigration, and what barriers people are facing when trying to access the hospital's healthcare providers in this context. So I do think that it has, as Professor Rooks mentioned, just kind of made it more clear that there's this huge gap in who's being served. And I do see there's a lot of commercials and radio ads about like, go get vaccinated and it's free, and it's, you can go to community centers, which is great. But I also think in a bigger context, it still kind of exemplifies that there's a huge gap, and especially with the undocumented community who are afraid to go seek assistance because of their immigration status.
Thank you. So we've heard about how it can help benefit some of the populations we serve. I'm wondering, Tracey, can you speak to why the program is unique and what students gain out of completing the certificate?
Sure. So this is the first program of its kind in the country. Normally, the idea of health justice is taught as a cohort at the doctorate level between medical students and law students, sitting in the same classroom together and learning together. But what we've done is we've brought that to the master's level and brought it to really more of the frontline workers, the boots on the ground, the people who are interacting with the patients and the clients every day, sometimes behind the scenes, trying to figure out if they can afford their medications or if they're able to afford their food, and working with the different members of the team to get the patients the resources that they need to have a better health outcome. So it's unique because we're bringing it to that level, and we're not only focusing on medical legal partnerships, we're also looking at developing students' leadership qualities. We're looking at social epidemiology. We're doing a study of population health. So we're really trying to make it holistic, as Zaidas was saying, and trying to really prepare the students to go out and look at the patient as more than just a diagnosis. On the legal side, look at their client as more than just a cause of action or how they're going to pursue a certain legal remedy. That we want to step back and we want to look at the person as a whole and their circumstances as a whole and how that fits into society as well. So I'm a little bit biased because I developed the program. So I think it's really great and can serve a lot of different people in a lot of different fields, with public health, anyone working in the legislature, paralegal students, lawyers, doctors, social work, psychology. It really just runs across lots of different disciplines, and I'm excited for the students that we're going to be having in the spring.
Thank you, Tracey.
Absolutely. And if I can just chime in, I think that, you know, as Professor Rooks was saying, it being the first of its kind, it's also very exciting for us to be part of the advisory board and just helping it shape, or, you know, figuring out what the best course of action or the best way to, you know, teach about the different topics. And even for myself, being a practitioner, it was really great learning about other disciplines and how, you know, learning about the healthcare system myself, and not, you know, and also learning about medical school versus law school, and something that, you know, is part of the book that is assigned, and learning how there's so many different areas that are intersect with the healthcare system. And so I think it's very interesting, even for a professional going into this process. And so, you know, I think it will serve people really well.
Thank you both. So Zaidas, since you brought it up, what advice would you give anyone interested in entering into the field of law?
Sure. I mean, I think that someone who's interested in a field of law, well, there's two different ways. Like, if you're interested in applying or going to law school, I think it's really important to kind of get exposure to the practice and the area that you're sort of interested in by volunteering, by doing internships, to figure out, like, is this something that I want to do? And someone who's, you know, graduated and ready to start their practice, I mean, I really think it's important for them to remember that there's so much need out there, and that they can do pro bono work, and regardless of their going into corporate law, right, big firm, or even government, right? I mean, I think there's a lot that people can do to help people who are underrepresented, underserved in our communities. And I mean, my career has been in the public sector throughout my practice, and so I'm kind of biased a little bit, and I really enjoy doing the pro bono work and helping our community. But I think that anyone, regardless of where you want to practice and what area of law you want to practice, there's always room and opportunity to help, you know, organizations, to help directly, to volunteer your time and helping the underserved and unrepresented communities in the system.
Thanks, Zaida. So let's see, Tracey, I'm wondering, what are the requirements to apply to the certificate program?
A bachelor's degree. So if you have a bachelor's degree, you can apply online. And part of that is official transcripts, a resume, and the application fee. So this program pairs really well with the Master of Healthcare Administration. We have students who will enter the certificate program before the MHA, or they'll come back after their MHA and get a little bit more specialized training in health justice. Recently, we've had students who were, like Zaida mentioned, preparing to go to law school and wanted to get kind of some advanced knowledge on that specializing between the medical and legal fields. But yeah, bachelor's degree, online application, transcripts, and resume and application fee.
Great, thank you. Okay, Zaida, I've got one more question for you.
Sure.
Can you explain what social determinants of health are and how they fit into this program?
Sure. Well, I'm most familiar with the social determinants of health through the individual's immigration status. And so, that's something that we discuss that is discussed in the Health Justice Certificate program. And even in the book, there's a couple chapters about how to work with individuals who are undocumented and also what can individuals who are undocumented do to obtain access to the healthcare system. And, we also talked about we had a couple podcasts that we recorded about this topic, and just learning about what public benefits individuals who are undocumented have access to, right? And so that's another, I think, barrier, right? In immigrants accessing the healthcare system is cost, and being afraid of like, how much is this going to cost me? Am I going to be able to go? And so then there are times where people won't go to the doctor until it's unfortunately too late, or they're in a place where it's just really dire, right? And it's life or death situation, instead of going to get preventive care, right? Because they're afraid and they're not sure that they're going to get any coverage and how they're going to pay for this. And also we talk about in the class or in the book, we also talk about language barriers, right? What can you do when someone is doesn't speak English and like they do want to access the healthcare system, like how to best serve that population. And so I think this is really important part of the certificate program, and learning how to deal and work with different populations and how to treat them properly, with respect, right? In a language, hopefully, and in a way that they understand. And we also talk a lot about cultural norms and what that looks like and how that might affect, care and even talking to the doctor themselves. And so, and another aspect that we go into in the class is domestic violence, and how we can issue spot, or what we can do through the medical legal partnership to address that, right? If there is that situation going on with a patient client. And so that's kind of my familiarity. So I don't know, Professor Rooks, if you want to talk a little bit more about in the health context, what that kind of looks like as well.
Sure. So in the medical legal partnership framework, we talk about, the acronym is IHELP. So the I stands for income, what public benefits are available, like Social Security, disability, food stamps, utility assistance. Then the H is for housing, so landlord-tenant issues, mold, rodents, flooding, getting a safe place to discharge after a hospital stay. The E is for education and employment. It's two sides of the same coin: education for kiddos and employment for adults, and really helping make that transition, especially for kiddos who are special needs and have resources as a pediatric patient. And then how do we transition them into the adult care world and help support them from education to employment. Those are things like IEPs, trying to make accommodations in the workplace, and just generalized planning. So then we get to the L, which is legal status, that Zaida has such a depth of knowledge about for immigration. But we also talk about legal status for veterans and being discharged from the military and making that transition into civilian life, but still accessing care through the Veterans Administration. And finally, the P is for protection. So that is guardianships, again, both for the young and the old. One of the really sad chapters in the book is talking about estate planning and planning for cancer patients, and how are they going to sometimes set up trusts or kind of a custody arrangement for children if the parent is terminally ill. So we go through quite a lot beyond kind of what we've all come to know as the basic social determinants of health. We kind of expand and go into these really specialized areas. But we've got great people on the advisory board to help us take that deep dive, like Zaida. We also have Kathy Jensen, who's a attorney in Spokane. She does education and family law, and she's a member of the Kalispel tribe of Indians. So she does a lot with tribal law. Dr. Andrea Chatburn is a palliative care doctor and a physician ethicist. So she gets into a lot of these gray areas between medicine and law. And then we have Brianna Gehring, who is a compliance manager with Providence. And she really helps us take all of our ideas and package them into deliverables for students. And she's wonderful with that compliance background as well. So we have a great team, and we're very excited to present that to the students and be there to help support the students.
That sounds like a wealth of knowledge and super board. That's great to hear about. So we have a couple questions from the audience here. The first one asks to explain, how can this program help people get medical care without being afraid of being deported?
So education is key. Getting the word out that these are medical legal partnerships, first of all, are at no cost to the patient. They are funded either by grants or other types of funding through the hospital or through the Legal Aid Foundation. And we should probably clarify that this is only for civil legal needs. There's no criminal representation here. That's what public defenders are for. So getting that awareness out there to the immigrant communities that this is a free service, that they're not going to be turned into the government. And again, that's one of the things that Zaida has so much experience with, in getting the word out through the different legal clinics that she has put on all across the country, Washington, New Jersey, New York, and has that experience in reaching people who sometimes don't want to be found. And I don't know, Zaida, do you want to talk more about your experience doing that? It's fascinating to me.
Right. Yes. I mean, I think that in our work, we try to figure out what the best way to reach a lot of people with the least amount of resources, as we're, nonprofit organizations at times, and legal clinics are a great way to do that, and doing Know Your Rights presentations and explaining to people and educating them about their rights, their responsibilities, how the systems work. And so, I've been really fortunate. I'm really passionate about social justice initiatives and access to justice initiatives, and how to help people understand their rights or responsibilities, and also how to access legal resources.
Great. Thank you both. Okay, one more question from the audience. Is it possible to take the course online?
Yes, absolutely. The entire program is online. Additionally, it is asynchronous, which means that we post the syllabus, we post the assignments for the week, and then the deadlines for them. And then you can work on those assignments at 3 in the morning or 3 in the afternoon. We have some interest from international students that are 13 or 14 hours ahead of where we are here in the Pacific Northwest. But that's okay. That is the beauty of online learning and asynchronous learning, is that you can get it done whenever is convenient for you, as long as you get it in by the deadline. So absolutely, we love online learning, and University of Providence was really ahead of the game. When COVID hit, everyone had to make this transition to online learning, but University of Providence just kept marching along. It was something that they were always doing. And so we really didn't lose any time when COVID hit. So it's a great program, and it's run very well from the tech side. So absolutely, online learning is the best.
Thank you, Tracy. Okay, as we're wrapping up, is there anything else we haven't covered that either of you would like to address?
I think we've hit on all of the high points. I would just welcome any other questions from the audience. We're here to help. If you have a specific legal question, we're happy to forward that on to an attorney, because similar to the disclaimer about medical care, we also can't dispense legal advice unless we're in an attorney-client relationship with you, which is, again, something you learn in this program. So feel free to ask us questions about the program, or we can try and put you in touch with an attorney if you do have a legal question. Zaida, any other?
Absolutely. Yes, we just invite all our community members, professionals, students, whoever, to learn more about the program and really, go to the page on Providence and just learn more about the Health Justice Certificate and how, what you can do with it and how it really help with different aspects of your work. So thank you again for the invitation, Mary Kate.
Yes, of course. So you can learn more about University of Providence programs at uprovidence.edu on the website Tracy and Zaida mentioned. So thanks again, Zaida and Tracy, for joining us today, and to everyone for listening and sending in your questions. You can learn more about Providence initiatives, programs, services, ways to give, or you can look for medical help or advice by visiting providence.org. And you can make sure to follow us on social media at Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. Once again, thank you so much for joining us today.